All of us have loved ones that are getting older, that are getting wiser, that are getting more and more stubborn in taking care of their health. It's not just me. So what does that mean? You tally up the symptoms that they have day to day, and it starts small. It hurts when they walk. That's fine. Their limbs feel a little swollen, feet kind of, it looks weird. Not a big problem. Then it gets worse. They stop being able to sleep through the night due to the pain. When you look at their skin, it might be shiny, or worse, it might look dead. This is a very common occurrence for patients that come into the hospital with chronic limb-threatening ischemia. That is the most severe form of peripheral arterial disease. It's a chronic disease that's rising in our aging population in the United States. It's not going away. Treatments can range from vascular regeneration, being able to do limb salvage procedures to save the limb. In the worst case, amputation. And it's a very common case. Now, time is of the essence in training this. What happens if your loved one is he can get treated. He might be able to salvage the limb, but the facility does not have the resources to do so. You have to do the procedure anyway. He will survive the amputation, but his life has changed forever. In these cases, you might wonder, where did it go wrong? What could I have done better? We wanted to see whether facility constraints could be a big factor in whether you have the opportunity to walk again or whether you have to get an amputation. We looked at the national inpatient sample and looked at limb salvage procedures across 240,000 patients from 2000 to 2020. We looked at facility-based payer constraints, such as Medicaid-level payer burden, as well as different facility types, hospital procedure volume, size, whether you're a research hospital or not. What we found is across the board, no matter what region, size, insurance that you came in with, if you were a patient with CTLI and you presented at a hospital with a high Medicaid payer facility burden and a low volume procedure, you were significantly more likely to have to get an amputation without a chance for limb salvage. So what does that mean? First, we have to acknowledge that not all hospitals are created equal, and they shouldn't be punished for being so. They need support. So what does that mean? We have had revolutionary procedures that we need to bring to these hospitals, and we need to examine where the breakdown from payer mix to facility burden to patient harm begins. Hopefully, we don't have to make someone choose between saving their life in the future and walking again. Thank you.